Welcome to the video, where we will be discussing how people lose weight so quickly. Quick weight reduction can be accomplished through a variety of means, but it is critical to remember that long-term weight loss should always prioritize a healthy lifestyle, a well-balanced diet, and frequent exercise. While investigating how people lose weight so quickly, examine the following points. Caloric deficit is a well-known principle for quick weight loss. It entails ingesting less calories than the body burns, resulting in a negative energy balance. A calorie deficit of roughly 3,500 calories will result in a 1-pound weight loss. It is important to remember, however, that the rate of weight reduction might vary depending on a variety of factors such as age, gender, genetics, and lifestyle factors. A daily calorie deficit of 500 to 700 calories is regarded safe and beneficial for healthy weight loss of 1 pound per week. This rate of weight loss is also thought to be sustainable, with less risk of muscle loss or nutrient deficits. Very low-calorie diets, on the other hand, can cause severe muscle loss, metabolic adaptation, and nutrient deficiencies, all of which can be harmful to overall health. Individuals can produce a calorie deficit by reducing their calorie consumption through a balanced and nutritious diet that includes protein-rich foods, whole grains, fruits, vegetables, and healthy fats. People can also raise their physical activity levels by doing things like going to the gym on a regular basis to burn more calories. It is critical to understand that weight loss is about more than simply calorie restriction. It is also about developing a healthy lifestyle and long-term behaviors. Quick weight loss through extreme calorie restriction is not advised because it can have long-term health effects. Instead, it is critical to concentrate on making small, long-term modifications to one's food and exercise routine that will result in long-term weight loss and improved overall health. To summarize, the main premise of quick weight loss is to create a calorie deficit by consuming less calories than the body burns. A daily calorie deficit of 500 to 700 calories is regarded safe and beneficial for healthy 1 pound per week weight loss. However, for long-term weight loss and improved general health, it is critical to focus on making durable modifications to one's food and exercise routine. A low-carb diet is a common weight loss strategy that involves limiting carbohydrates while increasing protein and fat intake. In the first few weeks, this diet has been demonstrated to produce rapid weight reduction, primarily in the form of water weight and glycogen storage. When carbs are restricted, insulin levels in the body fall, resulting in a decrease in glycogen storage. Glycogen is a form of carbohydrate that is stored in the muscles and liver, with each gram containing 3 grams of water. As a result, as glycogen stores diminish, the body sheds excess water weight, resulting in a considerable drop in body weight during the early phases of a low-carb diet. It is crucial to remember, however, that this weight loss is primarily due to water loss and not necessarily fat loss. While a low-carb diet can result in fat loss over time, the initial weight reduction is primarily due to water loss and glycogen depletion. It is also important to note that a low-carb diet may not be appropriate for everyone. A low-carb diet should not be followed by people who have certain medical conditions, such as kidney disease, because it can place additional strain on the kidneys. Furthermore, the long-term consequences of a low-carb diet on overall health and weight maintenance are still being researched. Finally, a low-carb diet can encourage quick weight loss by lowering water weight and glycogen storage early on. It is crucial to remember, however, that this weight loss is primarily due to water loss and not necessarily fat loss. A low-carb diet is not for everyone, and the long-term implications on overall health and weight maintenance are still being researched. Intermittent fasting is an eating pattern in which fasting and eating periods alternate. Intermittent fasting can be done in a variety of ways, but the most prevalent are the 16/8 approach, fasting for 16 hours and eating within an 8-hour window, and the 5-2 method, eating normally for 5 days and restricting calories to 500 to 600 for 2 days. According to research, intermittent fasting can be an effective weight management method since it reduces calorie intake while increasing fat burning. During the fasting phase, the body's insulin levels fall, causing stored fat to be broken down into fatty acids and glycerol. These molecules are subsequently transferred to the liver and transformed into ketones, which can be used as a secondary energy source for the brain and muscles. Furthermore, intermittent fasting has been proven to improve a variety of health indices, including blood sugar, cholesterol, and inflammation. It may also help with brain function and longevity. Some research indicate that intermittent fasting can improve cognitive ability and protect against age-related deterioration, while others demonstrate that it can increase animal lifetime. However, intermittent fasting may not be appropriate for everyone, particularly individuals with specific medical issues such as diabetes, eating disorders, or pregnancy. It may also produce appetite, weariness, irritability, and constipation as adverse effects. As a result, it's critical to check with a healthcare expert before beginning if and to ensure that appropriate nutrition is maintained during feeding times. To summarize, intermittent fasting, IF, is a popular strategy of rapid weight loss that involves alternating periods of fasting and eating. It can lead to calorie reduction and increased fat burning, as well as improvements in numerous health indices and brain function. However, it may not be appropriate for everyone and may result in certain negative effects. As with any diet or lifestyle change, it's vital to see a healthcare expert and ensure that sufficient nutrition is maintained. HIIT, high-intensity interval training, is a style of exercise that consists of short bursts of intensive activity followed by periods of rest or low-intensity exercise. The interval duration and intensity can vary, but a typical HIIT session lasts 20 to 30 minutes. According to research, HIIT can be an effective weight loss approach because it burns a large number of calories in a short period of time. The intensive activity during the intervals can raise the body's metabolic rate, resulting in a higher calorie burn even after the workout is finished. Furthermore, HIIT can assist maintain muscle mass while burning fat, improving body composition and metabolic health. Furthermore, HIIT has been demonstrated to provide a variety of health benefits, including increased cardiovascular fitness, insulin sensitivity, and blood pressure. It may also improve brain function and alleviate sadness and anxiety symptoms. However, HIIT may not be appropriate for everyone, particularly individuals with specific medical issues such as heart disease, joint problems, or pregnancy. If not performed appropriately or with adequate rest and recovery periods, it may also result in negative effects such as muscle soreness, exhaustion, and injury. As a result, before beginning HIIT, visit a healthcare practitioner and a competent fitness professional, and gradually raise the intensity and duration of the workouts. In summary, high-intensity interval training, HIIT, is a type of exercise that consists of short bursts of intense activity followed by periods of rest or low-intensity exercise. It can be an effective weight loss method since it burns a large number of calories in a short period of time while also improving body composition and metabolic health. However, it may not be appropriate for everyone and may result in certain negative effects if not practiced correctly or with necessary rest and recuperation intervals. Before beginning HIIT, like with any exercise program, consult a healthcare practitioner and a trained fitness professional, and gradually increase the intensity and duration of the sessions. Bariatric surgery, often known as weight loss surgery, is a medical technique used to help people lose weight, particularly those who have struggled with obesity. The operation includes changing the shape of the digestive tract to limit the amount of food the stomach can hold, reduce nutritional absorption, or both. The goal is to achieve a considerable and long-term weight loss, which can lead to significant improvements in obesity-related health conditions. Those with a body mass index, BMI, of 40 or higher, or those with a BMI of 35 or higher plus at least one obesity-related medical condition, are usually candidates for bariatric surgery. Type 2 diabetes, high blood pressure, sleep apnea, and joint discomfort are among the medical issues. However, bariatric surgery should only be considered as a last resort when non-surgical treatments such as diet and exercise have failed to result in significant weight loss. Bariatric surgery is a sophisticated process that necessitates the participation of a multidisciplinary team of medical specialists, including a surgeon, anesthesiologist, and nutritionist. Gastric bypass, sleeve gastrectomy, and adjustable gastric banding are the most prevalent types of bariatric surgery. Gastric bypass surgery involves separating the stomach into two sections, one of which is attached directly to the small intestine. A major section of the stomach is removed during a sleeve gastrectomy to create a smaller, sleeve-shaped stomach. Adjustable gastric banding entails wrapping a band around the top of the stomach to form a smaller pouch. Bariatric surgery has been found to be an effective method for achieving large and long-term weight loss, resulting in better overall health and quality of life. But, it is not a miraculous solution and takes a lifetime commitment to healthy diet and frequent exercise. People who have bariatric surgery must also have periodic follow-up meetings with their medical team to ensure long-term success and to manage any issues that may arise. To summarize, bariatric surgery is a viable treatment option for those suffering from obesity and other health problems. However, it should only be used as a last resort when non-surgical methods have been exhausted and proven fruitless. The choice to have bariatric surgery should be taken after thorough consideration of the risks and benefits, and with the assistance of a medical team. Finally, while there are numerous strategies for achieving rapid weight loss, it is critical to focus a healthy lifestyle and food adjustments for long-term sustainable effects.